Hello, my name is Erin Encarnacion Emiliano. I'm going to talk about the primary care in the Havanas. Specifically, I will talk to you about the specialties, so let's go. Okay, number first, nurse. To become a nurse is the Havana. It can around 3 or 4 years. Okay, obviously depends on how many subjects you select for semester or quarter. Okay, doctor. To be a doctor in the Havanas, you can take around 4 or 5 years. Specialties, this many very depending on the specialty you want to do. Generally, after you completing your career in medicine, obviously, and you are required to complete a medical residency that can last from, for example, 3 or 7 years, depend your specialties. Okay, a good question is, what does a nurse do in the Havanas? Number one, their patients are, this included the administration of the medical, obviously already mentioned by the doctor. Okay, vital signs assistance as checking that everything is okay. Okay, education and advice, educate the patients and their families about the disease. Okay, other question is, what does a doctor do in the Havanas? Has many responsibilities, including number one, direct patient care, perform physical examination, diagnose illnesses, prescribe treatments. Number two, says management, work with other professionals to ensure good treatments. So, education. Number three, education. Educate the patient about their illness. Okay, investigation. Participating medical research to improve understanding and treatments. Okay. Administration is some case doctor can check that everything is fine in the hospital they were in the other hospital. So in the Havanas that is normally, so it's normal. Okay, and finally, what a specialty performs depends on your specialties. Okay, it's the same as here. So Dominican Republic is the same. It depends. But for example, a surgeon will perform a patient's 3 diseases. A pediatrician is in charge of caring for children. So it's like that, about that. So thank you for listening. Bye.
Hello, my name is Luisa Fernanda Diaz Brujan. A continuation, I work with of the laboratories and diagnosis in Bahamas. In the Bahamas, primary health care is extended beyond basic consultation, also includes access to laboratories and diagnostic services. These services are the essential to support the diagnosis and the treatment of the various medical conditions. These include laboratories tests such as bloods, urines, and stool tests, as well as imaging the tests as X-rays, ultrasounds, and arise the additionally specialized tests such as evaluate the cardiovascular, the heart lens, the function, the test laboratories, tests for incapture, dissected, and maximum. In Bahamas, there are several laboratories and medical centers. Some of the best known laboratories include the Dr. Aspectson Ignacio Family's Medicine Center in Freeport and the Tallahassee Laboratories in various locations. This center can perform a variety of the diagnostic tests. Largest hospital and clinics generally have the more comprehensive the diagnostic facilities, while smaller clinics may offer the more limited range of the steps they use. Americans Standard Health Center and the clinics had the modern technologies and the trained staff the state provides at coherence and timely research. Although the quality of the services is high, some can be expensive, so it recommends the test purchase and get weight her influence before traveling the state country.
Hi, my name is Naomi Garcia, and today I go to talk about the medical prescriptions and medical care in specifically in the Bahamas. Well, the medical prescriptions in the Bahamas are typically using on paper with the name and information of the prescribing doctor as well as details about the patient and the prescribing medication. Doctors must to adhere to ethical and legal guidelines when prescribing medication, including evaluating the patient and considering any allergies or drug interactions. And when we talk about the medical care, we need to say the state itself provides financial support to healthcare the system of the Bahamas. So most services for patients are free. Firstly, pregnant women, government officers, children, and individuals aged 16 above have free medical care. The most important hospitals are the Ram Memorial Hospital, Princess Margaret Hospital, and the Doctor Hospital. The most big hospital in the island is Princess Margaret Hospital. Then is Ram Memorial Hospital, and most important clinic in the country is Doctor Hospitals. So, despite the relatively small size of the Bahamas, more than 2,000 hospitals and clinics can offer all kinds of treatments with high quality. So, this is my presentation. Thank you for watching.
Hi everyone, my name is Genderly and today I'm gonna talk to yours about mental health of Bahamas. The mental health of Bahamians can be influenced by a variety of factors, including culture, social, economic, and access to health care consideration. Here are some general considerations. First, cultures and beliefs. The cultures in the Bahamas can influence the perception and understanding of mental health. Attitudes towards mental resources may vary depending on culture and religious beliefs. 2. Access to healthcare. Will the Bahamas have a healthcare system including mental health care? Access may be limited in remote areas or due to financial constraints. The ability of trained mental health care professionals may also be a factor. 3. Stigma. Stigma associated with mental health uses can be a significant challenge in the Bahamas. As in many other cultures, this can make it difficult for individuals to seek help and support out of first or of judgment or discriminations. Fourth, socioeconomic factors. Poverty, unemployment, and homelessness can increase the risk of mental health problems in the populations. Socioeconomic disparity may limit access to resources and support services. 5. Community resilience. Bahamian community may display strong resilience in the face of challenges, shock as natural disasters, like hurricanes, which have historically affected aviation. However, these events can also have a significant impact on mental health, particularly in the term of post-traumatic stress and anxieties. 6. Social support. Support from family, friends, and the community can play a crucial role in the emotional well-being of behaviors. Support networks can provide a buffer against stress and emotional difficulties. Thank you.
Hello, my name is Eliezer de la Rosa y estaré hablando sobre la atención primaria en las Bahamas o Bahama Primary Healthcare Wavy. In the Bahamas, primary health focus on values of equity, social solidarity, and the right of every human being to enjoy and high level health without distinction break, religion, political belief, economic, or social condition. This country has implemented the Bahamas National Health Insurance Program 2016, which offers residents access primary health care free, share, at the point of service. Additionally, lifestyle changes promoted to personalized nutrition or wellness program, program and high quality health service. The health model forward being the prevention of the health of the people, rendering exceptional, providing free, efficient, dignified, timely, and quality of the effective health service. It is proposing a strategy provide healthcare striving for the well-being of individuals, families, and communities. Satisfy health need to life